Hello everybody and welcome back to the channel. I'm Kevin and this is going to be a series of mental health, whether it's disease, diagnoses, other things to that effect. I myself suffer from a few of these: depression, anxiety, and PTSD. I know others that suffer, have been diagnosed with the same and maybe more. All of the information that I will be giving you, I have found somewhere on the internet. You can also go to the VA's website. They've got a large slew, the Cleveland Clinic, so on and so forth. It took me a little while to do some research, but yes, I do have research here. It's basic to pretty much the nitty gritty. And I just want to bring this to light. It's something that's not being taken care of too much. And for whatever reason, who knows? So without further ado, the first one I'm going to start with in this episode is depression. I myself have been diagnosed with I myself have been diagnosed with depression at some point, but it is the most common of mental health issues here in the U.S. About 8% or 21 million Americans suffer with it per year, and there are about 15% or 3.7 million youths between the ages of 12 and 17 that have been diagnosed or suffer with the depression. Again, when I get done with this, I will give you some of my thoughts and opinions personally. Some of the causes are are none to several factors. It could be any number of things. You could just fall into a depression for no absolute reason, or there's things that occur in your life that would cause it. Biologically, what it is too much or too little of the neurotransmitters in our body, which is a chemical messenger that transmit signals between neurons and other cells in our body. That's a biological thing. You want to know more about it? Unfortunately, I'm not the guy to ask, okay? I just know that, I guess in easy terms, messages that go from here to here, okay? Here, it starts here, it comes down here. Cognitively, it's negative thinking with low self-esteem. So, just be mindful of others that may be dealing with it. Gender-wise, it affects women more than men. From what I read, there's an unclear reason why. I could have some thoughts and theories, but we'll get to that later. Co-occurrences are medical: heart disease, cancer, people with Parkinson's, diabetes, the list goes on. And there are meds that can help with it. And it's also genetic and situational, okay? Situational as in what in your life is not helping you. I mean, now we're going to get into types of depression, which is major. You're depressed every day for 2 weeks, insociable, with low mood, low self-esteem. Then you have persistent, which is lasting days to 2 years or whatever the case may be. And then women know this more that have children, you have postpartum depression. That is a biggie, in my opinion. I'm not saying that men can get postpartum depression. I was there, so I get it. Some of the symptoms are persistent sadness, anxious, little sleep, too much sleep. They're waking up in the middle of the night, early. Their weight fluctuates often, and then again, in major cases of it, there's suicide. And then the treatments are, you seek therapy, you go on meds. Now, for this aspect of depression, I've probably been depressed most of my life, with my parents, my mother having cancer multiple times, my mom remarrying to a guy that was a complete douchebag. I was picked on in school. I mean, some people look at me like, you picked on in school? I'm like, yeah, I was picked on in school. I got to a point in my life, wanted to change it. But those are just a few instances for me. Other instances are, financial. I'm depressed because I can't afford things or I can't do certain things. I get to that. I, from time to time, still get depressed. My biggest thing is, for me anyway, is when I notice I'm depressed, I will stop myself and think, and I analyze myself. I've told my therapist this. Yes, I do see a therapist. Some people are probably shocked. But even he was kind of surprised that I will stop, think about what is going on and why, and if I can or cannot fix it or something along them lines. If I can fix it, I will fix it. If I can't, then I have to just tell myself I have to let it go. In other cases, such, therapy is a good help. My other recommendation is you find stable individuals, okay? You find other strong individuals. If they can help you, if they can guide you. Drugs and alcohol are the worst thing you could possibly do. As a first responder as well, and again, my way of thinking is, if you start getting into drugs and alcohol, you have to remember it's a temporary fix. It's a momentary fix. So you might be, if you're depressed right now and you're thinking, I'm going to go score something, or I'm going to go to the bar, or I'm going to go to the liquor store and get some liquor, it's going to be a fix for that moment. The way I feel is once you come out of it, it's not only is it that issue going to still be there, but you're going to put another issue on top of it, and you're going to continue to put issues on top of one another, which leads into major depression, leads to more alcoholism, more drug addiction. Again, everything that I'm saying here is just my thought, my opinion, my own personal, whatever you want to call it. As for certain illnesses being brought into it, Parkinson's, cancer, for those individuals where that comes into play, where your medical condition is making you depressed, again, my personal recommendation is to find that stable ground, whether it be somebody you trust, somebody going through it, a therapist. Maybe it is a combination of friend, the trusted person, the therapist, and maybe some medication. I know somebody that thinks that medication is not the answer. I disagree. Medication is a help, not. Okay, let me retract. They say that medication is not the answer. Correct. But it is an assistant. But you mentally have to be able to continue on with the dealing with it, I guess. So if you can deal with it, learn from it, it'll make you that much stronger. So again, as for me, my first thing is recognize, analyze, speak. If you don't feel like speaking, here we go. Get a piece of paper, journal it. What is bothering you? Okay? But again, I would recommend you find trusted individuals that you can speak to, including a therapist. My personal thoughts, my personal opinions. Do what you wish. Sorry this was a little dry, everybody. I want to thank you all for coming out. Again, there's more to come. Peace.